My name is Dr. Cheryl Rosenblatt. I'm a developmental neuropsychologist specializing in the assessment and treatment of individuals with various developmental, neurological, and psychological difficulties that tend to interfere with their lives. The purpose of this particular talk is ADHD, specifically learning how we come to the diagnosis and the treatment interventions that are involved. At this time, I'd like to go over some statistics regarding the prevalence of ADHD. According to the Centers for Disease Control, as of 2016, it is reported that approximately 9.4% of school-aged children are diagnosed. This means that about 6.1 million children have ADHD, and that's quite a number. And if you look at the chart below, you can see that trends from 2016 to 2011 have remained relatively steady. But going back to 2007 and even further back to 2003, we can see a clear increase in the number of children diagnosed. Continuing with statistics, the diagnosis of ADHD is more common in boys than in girls by approximately 2.5 times. So in the general population, about 12.1% of boys are diagnosed, while only 5.5% of girls are diagnosed. So the question arises, why would this be? So the primary issue with the diagnosis of ADHD is that a lot of the diagnostic criteria are based on observable behaviors. And we know that boys are more likely to exhibit such behaviors, including poorly modulated reactions, emotional discontrol, and to be more active in their presentation. It's not that girls don't do this, but they're not quite as likely as boys to do this. And so boys are more likely to stand out and be referred for evaluation and treatment of the disorder. Another important fact to keep in mind when considering the diagnosis and treatment of ADHD is about 2/3 of children diagnosed with a disorder go on to become adults with ADHD. So before getting started, what I'd like to do is bring up a case of a 13-year-old girl. All identifying information has been removed, but this was an actual person who was evaluated by me. The purpose of providing this information is to be able to put all the forthcoming information into some type of context that makes it more real for you as the viewer. So Susan was described as an active girl with a lot of energy who preferred to be doing active things rather than sitting down quietly. She was able to fill her time with activities on her own and was not dependent on others for it. At the same time, she was overly talkative, had difficulty focusing, concentration waxed and waned, especially when it came to schoolwork or when reading. It should be known that both of these activities were quite difficult for her and both led to a lot of frustration. Parents and teachers reported that she has a hard time retaining information and following multi-step directions. She also required a lot of repetition, and those of you who have been diagnosed or know someone who's diagnosed, including your children, know that, things don't get done the first time that you ask them to. You need to do it often, over and over. And that's a source of a parent's frustration, for instance. Susan was also impulsive, tending to become angry quite quickly and often reacting aggressively. And this is also a common finding where children, have a minor setback and it becomes, a mountain instead of just a molehill. She was aware of her anger, but she was also aware that she had a very difficult time stopping it. One thing that you'll notice about individuals with ADHD, and this was the case for Susan too, She would start something and then stop in the middle, jumping to another. This happened with activities. She also presented with sensory sensitivities. And this is something that is common across many disorders, including autism spectrum disorders and anxiety disorders. So in this particular instance, Susan didn't like wearing denim, tight leggings. She was bothered by certain smells. Fortunately, if you live in the city, horse manure is not a particularly big issue. Pickles, if you go to diners, can be a problem. But, each kid has their own, way of expressing these sensitivities, and they're not present in everyone, but they are common. So, what is attention? Um, Basically speaking, it is the process that allows us to focus on what is relevant. And so, responding when your name is called, listening to the math teacher, or maintaining your focus on a movie. Attention is also the ability to not focus on things that are not important at the particular time. And this is important to keep in mind as we continue our discussion of ADHD. So what are the components of attention? We just tend to think of attention as this unitary thing, this big, task that we just all do. But there are multiple aspects to attention. And so, for example, sensory selection refers to our ability to filter, focus, and shift what we focus on. Response selection allows us to choose the proper response in a particular context so that, sort of do the right thing at the right time. Inhibition allows us to suppress attending to something that is less relevant. And so as we are listening to this talk, there may be someone else talking in another room, a siren may be going off, you may be in your own head doing something. Inhibition allows you to push all these things aside and maintain your focus on this specific talk. Then there's attentional capacity, and this refers to the amount of time that we can spend attending to a task, the amount of energy available to us, and the level of arousal and effort that is required to stay on task. Sustaining performance also involves fatigability. As you get tired or as your child gets tired, you notice that they're less able to focus, or you're more prone to making mistakes when you're doing something. And vigilance is, again, maintaining your focus so that when something is happening, you're able to shift how you respond to it as it's happening. And problems with attention can be associated with any of these components. So diagnosing ADHD. So the DSM-5, the Diagnostic and Statistical Manual, published by the American Psychiatric Association, came out with its 5th edition in 2013. And the symptoms are divided first into those associated with inattention. And these are the ones we're going to give our attention to initially. So, fails to give close attention to details and makes careless mistakes. Those of you who have school-age children, you may notice that they make silly spelling errors, they leave out certain punctuation marks, things that they clearly know how to do, but don't do because they didn't think of it at the time. If you've gone to the supermarket and you've left and suddenly you realize you don't have milk or avocados, these silly mistakes that you're smart enough to handle, clearly have the capacity, but just out of sight, out of mind. People with ADHD also have difficulty sustaining their attention. And so we mentioned sitting through a movie. If you're a big Star Wars fan, it's got a lot of action, not very difficult to do. But then you've got movies. For me, The English Patient was torture. They just talked and wouldn't stop talking. That movie had my sustained attention was zero. I think I paid more attention to my watch at the time. does not seem to listen when spoken to. And so in this case, you'd be yelling, Susan, Susan, Susan. And, she's either involved with her friends on playing Roblox, doing her own thing, with Legos or whatever task she's involved in, and doesn't really hear that you're calling. Following instructions. This is one of the big ones that teachers and parents complain about. And it's not necessarily, give me your shoes, easy enough. But give me the shoes after you wipe them down and then go do your homework. And, once the instructions become multi-step commands, then you're struggling. And so, children struggle academically. Adults struggle at work with this or struggle to maintain a household. Too much is happening, you can't keep up, you lose track of what you're doing. Difficulty organizing tasks. So those of you who work in corporate jobs, there's a lot of planning, a lot of organizing. Those of you who run your own businesses, you thought you wanted to be an accountant, but it turns out you have to do billing and paperwork and all of these details that need to be involved. But then you also have the kid who needs to keep their room clean or their backpack needs to be organized. And you open it and it's like something exploded in there. And so organization can involve a lot of different things. And those people who are disorganized in the way they handle their stuff, whether it's work, school, or belongings, also have a difficult time thinking in an organized way. And so it's that planning and organization component that affects you in multiple areas. And so in many cases, one thing that you see children and adults with ADHD do is avoiding or at least disliking activities that require sustained attention. And so if something you're doing is something you enjoy and you're willing to invest the time and effort, you do it quite well. But if you're sitting through Ms. Jones' social studies class and you don't really care about the Russo-Japanese War, your mind is completely elsewhere. Losing things, misplacing your keys, misplacing your pointer before starting this presentation and getting frustrated and doing without it. You also tend to be easily distracted. So the dog barking across the street, your child playing downstairs, screaming with his friends on Roblox, things just pull you off task. And forgetful. You intended to do something, you started doing something else, and then you forgot to pay your bills, and suddenly you've got a late charge on your credit card. Hyperactivity and impulsivity. So these are the more obvious signs of ADHD, and so little kids will run around in circles, jump all over the place, have a difficult time sitting still. They tend to be in motion and they report this sense of restlessness. When you're seeing teenagers and adults, you often won't see them just move around a lot. Sometimes you'll see fidgeting, playing around with objects, pencils, whatever's in reach, but oftentimes they'll report this internal sense of restlessness where, to you, the observer, they look like they're paying attention and staring right at you, but in reality, their mind is going 50 miles per hour. Difficulty engaging in quiet activities. So especially with younger children, you'll see them, talking in situations where they shouldn't. They call out in class, have a hard time modulating their voice. So, their whisper may be your scream. These kids are often on the go. They're rarely sitting still. They're rarely quiet. So sitting through a movie is quite difficult. They may talk excessively and incessantly, and you'll often find that they jump from one thing to the next. And so at one point they're talking about a game, and from the game they got this other idea, so they go off on that other idea. And so what happens is that conversations tend to become, they sort of just lose the focus. They go in a direction they didn't intend to. Waiting one's turn is difficult. and they often interrupt or intrude on others. So parents will notice that as they're having a discussion, suddenly little Willie is getting involved too. So to make the diagnosis of ADHD, the person must have at least 6 of the 9 symptoms of the disorder, of either inattention or hyperactivity and impulsivity. These symptoms need to have been present for at least 6 months, and at least some of these symptoms have to be present before age 12. And this is an update from the previous edition of the DSM where, the symptoms had to start during childhood. Not everyone has been evaluated before they were a kid. I get plenty of, young adults and even older adults who, tell me I've struggled all my life with these symptoms. Now they're having an impact. Can you help? And so now that you only need to have several symptoms after 12, we can diagnose the disorder in adults more easily. So it's not enough just to have symptoms, but these symptoms have to interfere. And, if it's not interfering in your life, you don't have a disorder. If the disorder is interfering, for example, at home or at work or at school, then it's something that needs to be intervened. And that's something to keep in mind. If it's not interfering, then it's not a problem. So don't fix it if it's not broken. And so the evidence has to be clear that it's affecting you in socially, academically, vocationally, or otherwise. Again, if it doesn't affect you, it's not a disorder. And the symptoms don't occur exclusively during the course of another disorder. So we have to make sure that, if there's a substance abuse issue, that it's not the substances. If you're taking specific medicine, that medicine is not causing your issue. If you've got a brain tumor, stroke, or something else that can be causing attention problems, we don't want to call that ADHD. So there are 4 types of ADHD. The combined type is by far the most common one, and it basically means that you have significant symptoms that include both the inattentive component and the hyperactive impulsive component. And this is what you typically see in most children. The predominantly inattentive type, you may still have some hyperactivity and impulsivity issues, but they're not the primary features. The main issue is your ability to stay focused, and as we'll discuss later on, issues with executive functioning. The predominantly hyperactive impulsive type is far less common than the other 2. Individuals with this diagnosis obviously are, the predominant features are the hyperactivity and impulsivity. You may find this in young children. You may find this after insults to the brain, traumatic brain injury, brain tumors, things of that sort. And ADHD not otherwise specified, you have some of the criteria, but they're not enough to meet the full diagnosis. So the impact of ADHD at home. And keep in mind that ADHD affects the child in nearly every environment. But at home, what you may see is difficulty following directions, keeping one's room organized. You'll see frequent arguments with parents and siblings over piddly things. Oppositional behavior, you ask them to do something, they just won't do it. They refuse to. Why? They don't know why, just because. And oftentimes, if it's bad enough, you'll see chaos in the house. Sometimes you see chaos in the house because ADHD is a genetic disorder, and when one person has it, it's more likely that another person will have it as well. Impact of ADHD in school. So again, difficulty remaining focused, daydreaming, doodling on your notebook. I remember the hardcover notebooks. I'd actually fill in those little white areas until the whole notebook was black. But that's not enough about me. You'll see poor grades, poor peer relations, And the peer relations, it's not because the kid's not likable. The kids with ADHD can often be in your face. They don't follow the general threads of a conversation, so they may interfere at the wrong time. They may behave like the class clown. And it's funny for a little while, but it also gets to be annoying. Rule violations. Kids with ADHD are more likely to get into fights, they're more likely to be oppositional, they're more likely to call out in the middle of class, and they can just be generally disruptive. Not always, but often. And they are often most disruptive to themselves, more than to others. So let's get a little bit into the treatment for ADHD. So proper treatment of children and adolescents with ADHD, and adults too, requires a multi-pronged approach. And so this allows the targeting of the various layers that are affected by the disorder. And so we spoke about, the social components. We spoke about, the emotional and academic components. So all of these need to be dealt with. Now, the typical treatment for ADHD again, it's multi-pronged, but medication can be a very important and very effective aspect of that treatment process. And, many parents that I speak to and, even patients say, I don't want to take a medication, or I'm not medicating my child. I don't want to put a chemical in their body. And that's true. That is what you're doing when you're giving medicine. In some instances, you can get away with it. You're a fairly high-functioning person. You've got it well put together. You can deal with a behavioral or cognitive behavioral approach quite well. When you're asking a younger child to do this, their brain is not fully developed. And at some point, we can have a separate lecture on the neuroanatomy of ADHD. But the brain is not formed to the point where the frontal lobes in particular that are involved in executive functioning, they're not quite where they need to be in order for the child to have the level of self-control that they need to. And so what medication does is it actually lowers the volume on things. So when the symptoms are extremely loud, you're a very active person, whatever the medication your neurologist, psychiatrist, or pediatrician decides, sort of lowers the volume a little bit. So you'll still be hyperactive, you'll still be inattentive, but not at the same level as without the medication. And one of the important things that I always point out is, you're lagging in school, your kid's lagging in school, so you give a tutor. You want them to be involved in cognitive behavioral therapy with a psychologist like myself. The problem with ADHD is that paying attention, internalizing, and using that information is quite difficult for them. And so the tutor may be the best tutor. I may be the best clinical psychologist you'll ever run into, but because you or your child can't really stay on task and pay attention and absorb what is being asked of them, the tutoring and treatment become less effective. The medication allows them the opportunity to stay longer with whatever the activity is. It doesn't teach you how to function more effectively. It doesn't teach you new social skills or how to deal with depression, anxiety, or substance abuse, but it gives you the opportunity to work with someone who can help you develop these skills. And so definitely consult with either a pediatrician, primary care physician, psychiatrist, or neurologist before taking any type of medication. Many family doctors and primary care docs are quite capable of doing this. Talk to them. If they don't feel comfortable doing it for, medicating you, then please speak to a psychiatrist or a neurologist. So behavioral intervention. There are many different components to it. When we talk about psychological treatment, the treatment has to be something that works for you. And so it's tailored to the specific person. You may benefit from just purely behavior modification. It's all you need. Bam, bam, you're done. A lot of other people will not be as amenable to that. There's more going on. There are emotional issues. It takes more time. And so you insert more cognitive and psychodynamic aspects to their treatment so that the treatment targets what the patient needs targeted. And so through behavior modification, the child or adult learns alternative ways to deal with the environment. So when it used to be that, something frustrating happened, they'd scream and run away. What's a better way of handling it? How do you know that you're becoming frustrated? Well, when I start yelling and screaming. Well, something happens before you start yelling and screaming. What is that antecedent behavior? What are the feelings that you have inside that give rise to it? Behavior management programs is something that we do with teachers and parents. Obviously, you're not going to do it with a boss because you want them to be less aware of anything wrong with you as possible. But developing a behavior management program with appropriate rewards and yes, even punishments. And so, when you want your child to complete their homework and, they don't have to get 100%, but they have to put in good effort. They put in good effort, you give them extra TV time, extra video game time. They can choose a yummy dessert. Punishments. Punishments you have to be careful with. They're good at stopping behavior as it is happening in the immediate. They're not good long term. They're not as effective. They don't really teach you alternative ways. And so a punishment takes something that you want away or insert something that you don't want. So for example, if a timeout is a positive punishment, negative punishment, you take away a privilege. And so they're not allowed to do something they expect it to do. And so you have to find what works. It's typically best if you, the psychologist, and the child come to agreement as to what will serve as a reward system and what type of punishments to use and when to use them. When everyone's on board, things tend to work more effectively. Being consistent is very important. Parents often have different ways of handling their children. It's okay to be different, but have a plan that both of you can implement. Collaborate with teachers, other professionals that are working with your child so that different settings apply similar methodologies. And keep in mind that it doesn't have to be perfect. It has to be just good enough, and you will screw it up at times, but your skills improve, so will the effectiveness of your program. So now we come to our final slide. Here we're talking about differential diagnosis. Here, what we want to do is make sure that when we're saying that you have ADHD, that it is ADHD and not something else that's causing your symptoms. And down here, over here, you have a list of some disorders that can mimic aspects of ADHD. You've got pediatric bipolar disorder, learning disorders, anxiety disorders, and brain injury. And so, for example, with anxiety disorders, attention is often limited, not because the span is short, but because you're paying attention to the wrong thing. When you have high levels of anxiety, it's your brain telling you, oh, I'm feeling overwhelmed. I can't handle this. I can't do what's expected of me. And so while you're focused on these thoughts of being overwhelmed, you're not focused on the math exam in front of you or on the letter that the boss asked you to write. And so different disorders can have overlap with ADHD, and it is important for you to see someone who is well versed in being able to diagnose this disorder and rule out other possible causes. And that brings us to the end of our talk. I'm more than happy to take questions. Send me emails, send me your comments. I'd be more than happy to hear from you as to what you liked, what you didn't like, and anything you'd like to see me do in the future. Thank you. My name is Dr. Cheryl Rosenblatt. I'm a developmental neuropsychologist specializing in the assessment and treatment of individuals with various developmental, neurological, and psychological difficulties that tend to interfere with their lives. The purpose of this particular talk is ADHD, specifically learning how we come to the diagnosis and the treatment interventions that are involved.